First of all, I would like to say hello to all of you. I have done my, I am Mohammed Sultan Islam from Pakistan, and I have done my MPA from there. And after that, I just joined, basically I'm an industrialist over there. And having two doctors at my home, one is my wife, she's a gynecologist, and other is my sister, she also is a gynecologist. But we have a lot of work in, I'm the lifetime member of WWF Pakistan, which is basically operated from the United States, name retained in the United States and Canada. But the organization basically in the London based. So this is my small, and also we have some, social works. We do many clinics like free welfare clinics in the peripheries, not in the city area, but in the periphery where hospitals are not available. Understand? So this is something. I'm here to tell now come to the point of maternal and child health scenario in Pakistan. Basically, this is the thing for which I here to conversate. And mothers and neonates are treated in Pakistan through MNCHC program, which is the Maternal and Child Health Program. So maternal and child health scenario in Pakistan, key maternal and child health indicators, MMR 350 to 450 per 1 lakh lives birth, which is so high. Yeah, very, very huge. Basically, the problem in the Pakistan is, so much diverse. The conditions are there, so much diverse, so much domesticated, and so much alarming because of the, bad conditions, bad economic conditions, and all that scenarios. And proportion of women 15 to 49 year at least, one antenatal care consultation 27%, and stillbirth attendance rate 24%, and contraceptive prevalence rate 34%, infant mortality rate 82 per 1,000 live birth, which is so much high in that area. Basically, there is no food and no clean drinking water in our country. People mostly have to drink the water from the almost the pipelines into the drainage, and they suck the water from the drainage. That's why so much diseases over there. And I'm from Jehlam. No, these statistics are basically from the UNICEF, and we collaborated we do our works through the USAID programs, WHO programs, which are there to inject their implementation through the giving aid to Pakistan. But for all Pakistan, because the health facilities are basically operated through the DHQs, which are district health hospitals. But having almost 185 million of people over there is a huge populated country. And due to the 80s Cold War being the ally of United States of America till our birth, before the subcontinent, India and Pakistan are both the same thing. Yes. But when the partition. That was not separation. That is partition. Separation is between a husband and wife. That is partition. Okay. Yeah, and that partition. After that, we are allied to United States of America. uh, from them, you know, and having so much problems over there due to that, you know, the Cold World War, and then the war against terrorism and all that. We suffer a lot in that. So our generations are, you know, suffering because the country, the Afghanistan, is a landlocked country. Yeah. Afghanistan is a landlocked country. We have to give bread, butter, and you know, each and everything to them also. That's why almost 650 you know, million people who migrated in this all you know, 9/7 event, and after that, that we have to look after them too and their families too. And even one Pashtun have, you know, four wives at a time. Yeah, Pakistani don't go for second, third, or fourth, but Pashtun have four wives, and they have so many kids with them, almost 12 to 13, 15 kids with them. So this is the scenario. Uh, so low birth weight is 25%. Prevalence of iron deficiency anemia in pregnant women 70%. You know, because there is no food for, you know, in peripheries, and so much devastating conditions over there. So 25,000 maternal deaths, 350,000 annually bear the burden of maternal ill health and sufferings. And child health scenario in Pakistan, every 1,000 children born in Pakistan, 100 children will not live to see their fifth birthday. Of these, 80 will die in the first year of life. Of these, 45 to 50 will die in the first month of life. Of these, 30 are died within the first week of life. Our commitment, Pakistan commitment to meet MDG, Millennium Development Goal. This is basically the program, I must say everyone knows about that. Yeah, in Pakistan also the same scenario. The Millennium Development Goal especially focus on women and children. And goal 4, reduce children mortality by 2/3 between 1990 to 2015. Goal 5, reducing maternal mortality by 3/4 between 1990 to 2015. Status of Millennium Development Goal, maternal health goal 5, target 2015, 140 per 1 lakh live births. Current rate is 350 per 1 lakh lines. And at current pace, MMR in 2015, 230 per 1 lakh live births. Status of Millennium Development Goal, Children Health Goal 4, target 2015, 40 per 1,000 live birth. Current rate is 77 per 1,000 live birth. At current pace, infant mortality rate in 2015, 61 per 1,000 live births. Health sector content, high population growth due to the reason of, the element of migration also there, no? Due to Afghanistan, problem over there. That's why. Low literacy rate, inadequate health sector allocation, poverty is all around there, because we have almost 18 hours of load shedding in our country. Water basically comes from, the Kashmir, which is the Jammu, which is territory of India and held by India. Water basically comes from the mountains of Kashmir, and they are building dams over there. Right? They are building dams over there and try to block our drinking water for, everything. So there is no drinking water for, upcoming generations. This is very, dangerous situation in our area.
Who built the dams?
India, at Kashmir.
Kashmir. Call that India. I mean, Kashmir. She asked who built the dam.
India.
Right, that's right.
Because,
Kashmir.
yeah. Anyhow, because our rivers are almost dry. Our rivers are almost dry. We don't have drinking water in our areas due to that reason.
What we hear about Pakistan, the Faisal and
Yeah, yeah.
Our technology and
No, technology is there. Technology is there. People are good. Industries are there. But this is the main reason over there. So, fragmented and poorly coordinated efforts among different programs, projects. Organization and management issues, human resource gap, issue of quality of care, lack of access, and underutilization of services, lack of awareness, and socio-cultural barriers. So governance issues also there as like everywhere, but there are, you know, most having weak governance due to the, you know, politicians and all that. The scenario is difficult over there. In the, you know, the basic medicines are not available, and PMDC, Pakistan Medical Association, that is also, you know, a body which is not in so much effective to do things with the, you know, hospitals and to do the care to the patients, and there is no allowance for the, you know, no allowance in the for the people and for the patients who go there. But we are trying to have manage all that with at our own you know, resources, as at our clinics we do 3 days for, you know, free consultation for the patients, and we randomly go to the peripheries with our you know, mobile car with the medicine came from donors and sometime from our own pockets. Then we go there and treat the patients and the, you know, women's and children's and all that.
And prenatal care, who gives the prenatal care?
Prenatal care,
Do
there
you
are,
have a lot of midwives?
yeah, lots of midwives, and you know, the LHVs are there. But I'm coming to that point. I'm coming to that point. So what have we done to achieve the Millennium Development Goal? The national health system has been strengthened through a number of program and projects. There are different projects like lady health visitors, EPI programs, which are basically coordinated from the, you know, first US gave us aid, and the other donor countries gave us aid like Japan, Norway, other countries. Then that aid come to the, you know, our federal through Prime Minister, then go to the provinces, and then from there to the, you know, DCO's office, district coordinators offices, and then from there to the DHQs, and then to the basic health units and all that. We work like that. So nutrition programs and has provide an impetus for comprehensive upskilling of maternal and child health initiatives. All future activities will be placed within the framework of National Maternal and Child Health Program. The National Maternal and Child Health Program process. So, as I said before, that this is inaugurated and been to working through a MOH in February 2005. Basically, Prime Minister, then provinces, governor or the chief minister of the provinces, and then from there it go to the DCO offices, and from there that come to the district health officers and district health hospitals. So salient feature of National Maternal Child Health Program. Maternal Child Health Program funding is an additional tied grant for upscaling of existing fund and activities. Unified policy of maternal and child health through an integrated national program, services and projects. aligned activities of donors, development partners, and to the program strategies through a programmatic approach, universal coverage, quality of care, and district focus. So, public-private partnership, there's a new concept of public-private partnership that is going to be inaugurated by the Chief Minister of Punjab, Mia Shehbaz Sharif, who is going to privatize the government hospitals and to have a new experiment on the people of Pakistan to do like that. That when you are going, he say that if he thinks, not say by words, but he thinks that if they are going to pay 1 million in the government sector hospital and 1 million medicines are going, but there is no coverage of advertisement and all that for him. But in that case, if he privatized that hospitals or with collaboration of public sector, he can have better coverage of that and can get money or income from that. Understand? Sorry, ma'am. Oh, that is so much pathetic conditions over the hospitals, over the DHQs. So much pathetic condition. Even no basic facilities for them. The in last week there is the city of Lahore, very well renowned government hospital, and a baby going to birth on the corridor of the outside of the hospital. This is the condition over there.
This is before privatization. What about now?
After privatization, the person who will get the contract, he will earn the money.
What about the people?
People are like people are on the help of God. People are there on the help of God. And everything is like that. So maternal and child health program strategies improve accessibility of quality health services, increases the demand of health services, strengthen the existing district health system. Hope so they can do that. Community-based community-based skilled birth attendant. Train and deploy 12,000 community-based skilled birth attendant. As you asked the question of the community midwives and all that. Community with the midwives, for that 124 midwifery schools functional over there in whole of the country. Strengthen Pakistan Nursing Council and Nursing Examination Board. Recruits, train and deploy. First they deploy 600 and in the last 6 months they deploy 324 new midwifery tutors who can tute through the private colleges and in the government sector. So there's another concept of 24/7 basic and comprehensive emergency on counter services. This is a good thing by the Chief Minister of Punjab, that if you before that, if someone goes to the emergency, first he has to report all the things, that where he comes and for why he come here to the hospital. If someone injured, he goes, he must have to bring a police certificate, which is FIR, first investigation report with him, and then they start, after 2 or 3 hours they start the after the paperwork they start the treatment of that patient. Understand? So but now they have things are changed. So emergency on counter service in 268 hospitals and basic emergency and counter services in 608 rural health centers which are there, and preventive services in 5,882 basic health units. Provide incentive to healthcare providers. This is another thing. And the postgraduate student rotation, if someone is in the urban area, rotate him from there to the rural area, and rotate from the rural area to the urban area. Training on EMOC, non-ops complications. A refresher course, there are so many refresher course for the nurses and other staff, patient care staff and all that. And attachments and teaching hospitals. Reimbursement of emergency transportation of deliveries. Uh, they are said to be, but not in existence. There's our last in 2005. There is a chief minister who is Pervez Elahi. He did a very good thing in Pakistan. He started a service for the ambulance service with the name of 1122, and that reaches within 5 minutes. If we call, if in emergency, that reaches within 5 minutes. That is a good thing, but and essential equipments, they provide essential equipments too. So child and neonatal health strategy, provide complete coverage for neonatal resuscitation and child care at all emergency on-counter facilities. Establish well baby clinic in all hospitals. Provide incentives to healthcare provider. Strengthen EPI services. Deliver through refreshers. Collaborate with nutrition program. Training on different program and refresher courses. Provide essential equipment to hospitals. So comprehensive family planning. For family planning, they have different programs and different staff to teach, like a lock and key, green key program. They said in our wording, chabi wali goli and that all, pills of keys and all that. Different programs are there, and contraceptive measures are also there. So MNCIC program targets to reduce the under 5 mortality rate to less than 65 per 1,000 live births by the year 2011. Target for 2015 is 45 per 1,000 births. To reduce the newborn mortality rate is less than 40 per 1,000 lives birth by the year 2011. Target for the 2015 is 25 per 1,000 births. To reduce the infant mortality rate to less than 55%, 1,000 live births by the year 2011. Target for 2015 is 40 per 1,000 live births. To reduce maternal mortality ratio to 200 per 1 lakh live births by the year 2011. Target 2015 is 140 per 100,000. To increase the proportion of deliveries attended by the skilled birth attendant at home or in health facilities to 90%. Target for 2015 is also 90%. Increase in contraceptive prevalence rate from 36 in 2005 and to 51 in 2010 and 55 in 2015. So factor facilitating scale up. High level of political commitments, National Health Policy 2001, Population Policy 2002, and 10-year Perspective Plan 2001 to 2011. And after that, Millennium Development Goal, which is nowadays going on. So essential maternal and child health service package at the community, primary and mid-level health facilities and secondary hospitals. These are the different ways to set the targets and to achieve the targets. In community level, maternal and child health package to reduce unmet need, to provide family planning services doorstep at doorstep, and information and education for empowerment and change. Parental risk assessment, referrals in pregnancy, parental care, birth preparedness, and skilled birth attendance, referrals for high-risk women for first-level care, and all that, newborn care and newborn postpartum care, easy and organized as to emergency on counter. So primary level health facilities, family planning, parental care, nutritional advice and supplements, normal deliveries of high risk pregnant women, basic minimum curative care to women and newborn. So mid-level health facilities, integrated rural health complex, family planning, same like that, na? Family planning, parental care, nutrition advice and supplements, normal deliveries of high-risk pregnant women, and all that. So secondary hospital, comprehensive emergency on counter, training and supervision of staff, and referrals linked with mid-level health facilities. All other services provided at primary and mid-level facilities. So expectations from Pakistan Maternal and Child Health, mobilize additional resources for existing funding gaps in national maternal and child health program, institutionalize research in maternal and child health program, capacity building for effective monitoring and evaluation process, technical assistance in training of private sector healthcare providers in maternal and child health. So at the end, I would like to share with you people Walt Whitman's good saying, the delicious singing of the mother or of the young wife at work or of the girl sewing or washing. Each sings what belongs to him or her and to none else. Thank you very much.